4 year of the university. Then after graduation from my middle schools, I went to did my service in Sao Tome and Principe. This is a small country in the Western Africa. So that was a very important period for me because doing that experience, it made me draw me to choose my specialty as a family medicine. Then also draw me to pursue my PhD in epidemiology. If we have time, we probably when I talk to my story, then we'll talk a little about it later. Then it's a lot of when I returned to Taiwan, I finished my residency training, my fellowship training. I also as a attending physician in National Taiwan University Hospital for almost 15 years. Due to I love to my this kind of the international or corporate health service. So during from the 2012 to the 2019, I also organized the International Medical Volunteer Service Program in Ladakh. So Ladakh, that would be a small, that's some area in the northern India. Interesting, this is also the some area. So although it is in the northern India, but it is definitely 100%, almost 100% per people there. They also their religion also the Buddhist. Very interesting area. So you can, I think you can Google it, then you can find a lot of information. So you'll see my background, right? Is background is in the Ladakh area. So 2021 September, I came to the US, and now I work in the Vertex Pharmaceuticals. I think that you have saw my very information there. So I want to share some interesting topic here because when I want to, I know the first CANDO would be focused on some neurologic disorder organization. So originally, I want to talk about Alzheimer's disease, because Alzheimer's disease is one of my previous research. But my PhD is in epidemiology, not the basic science. So I think for your interest, I mean, you are from a high school students, then you want to promote some awareness of the disease, right? So at the end of the day, you want to help the people. Yeah, right. So you want to do something. So it's something, whatever is in your community or maybe in the other community, maybe ex-US, right? So if you want to improve health, then today I want to talk about a little bit beyond the disease. I think a lot of the speakers, when you invite them, they must be the doctors. They must be some very advanced, very good researchers. So in the future, you can have a very good speech to talking about some different kind of neurological disease. But today I want to talk about from the micro to macro. So what from the micro to macro? When we're talking about disease, when we talk about what happened to the patient, I mean, we call the pathophysiology, right? I mean, previous speeches, when you shared some video with me, I saw a lot of the researchers will show from the basic science, from the gene, from the cell, from that level, what happened in the very micro level and to the patient. But when you want to improve the health, that will be also, of course, very important. But today I want to put my emphasis and my speech into the macro level. So let's talk about the one example. What is the macro level about health? Okay, this is a very interesting study published in 1992. It's almost you can say almost 30 years ago, right? So this is a very famous journal, the BMJ British Medical Journal. Then you see, if you see this topic, they talk they talk about social economic differential in the mortality, right? So there's evidence from the Glasgow. So Glasgow is the UK, okay? So graveyard, everyone will know what's a graveyard. So from this picture, what do you see? You see the different kind of the obelisk, right? So Some are high, some are short, right? So back to the around the 19th century, some researchers find that okay, in the Victoria age society, when people they are, I mean, when they are died, they when they are died and in the graveyard, and their family will build this kind of the obelisk for their relatives who died. Okay, so they find that very interesting finding. What kind of interesting finding? This interesting finding is that okay, what it means I can change. Okay, so that would be they find um in this graveyard, the patient who live longer, I mean, who life expectancy is longer, it seems their opposite, their height is higher. So what does this mean? Okay, this is very interesting, right? So why do they find I mean, if the height of the opposite is higher, it means the life expectancy of this person, we can say this person they died at an older age. Okay, so but what is the relationship between how can give our explanation? So if you see the numbers here, you will see consider a different age group. I mean a different age, birth year, because for example, you are a young generation, so we will expect the young generation can be live longer than our older generation. At least generally speaking, you will live longer than your grandpa, grandma, right? Why? Because you can say, okay, because medicine, you got a better medicine, then you got the very advanced technology, so you can live longer. Okay, this is one of the reasons. So in this study, they tell you, okay, for the men, it's around if your height is higher 1 feet, then you can get for the men, you can get 1.93 years. And for the women, you can get if you higher, then you can get one unit higher, you can get 2.92 years. So the reason is that the family who can build the higher, I mean your height is higher, the obelisk. It means you have more money, you have more power, your family support is better. Okay, so we cannot say you can, because this is happened, right? The person dead first, then the family build the obelisk. Of course, this is, I mean, the height of the obelisk cannot cause you live longer. But this kind of interesting phenomenon make you understand when we talk about health, if live longer is some kind of the indicator of the health, it is not totally about only the medicine. Sometimes your social economic status, right? I mean, for example, you are richer or you are poorer. This is also related to your life expectancy. It also refers to your health. So most of the time, I mean, in the future, right now, because right now we are in the 21st century, so you can see a lot of different kind of innovation, right? So I remember in your previous research talk about for first of all, you talk about not Alzheimer, you talk about Parkinson disease, right? Previously, you heard of Parkinson disease. This is all of the very cut of age study. Then earlier, you probably heard about the SMA. Then currently, we have a very fantastic drugs to treat the patient. Of course, that's very important because this kind of innovation is true, bring the new information and bring the new hope for the patient. But when we also talk about precision medicine, this is a very hot topic, I think, from your age. This is from 2015 or 2016 when the US President Obama talked about the precision medicine initiative. So not everyone, I mean, even for the pharma, for the scientists, everyone pursue the precision medicine. So I believe this new concept and the new development can bring the new therapy and improve the patient's life. However, you will see this very, very interesting future here. Okay. So those are the many factors to check, to affect the health. Okay. So you will see environmental and social factors, personal behavior. Okay. So the family history, genetics, and the medical care will also play a different percentage to affect the health. Okay. So if all of you here, one day you become a very good scientist, you become a good doctors. Okay, you bring the cut of age, a lot of innovations to a patient. So you probably can improve the right side, your right side, right? I mean, genetics, family history is cannot alter because your parents already, you are born from your parents, you cannot change it. But genetics is a lot of the new therapy, they talk about genetic therapy, right? So we can probably change the genetics right now. And the medical care is always improve. So we always have new therapy here, but even you can correct this kind of the things, you only have 40%, right? Then about a person, what is the personal behavior? While we talk about it, if your patient came to see you, he or she is still smoking, drinking alcohol, then she never change. Even you have the very new job, you cannot change his destiny. Finally, she or he will still die due to the complication from the alcohol drinking or smoking, right? And what's the environmental or social factors? Let me take the CANDO, for example, right? When CANDO, all the membership here, you want to promote the awareness. Is it important? Of course, it is important. Because without the awareness to the disease, how the patient can come to receive the drugs. For example, take for SMA, for example. If SMA, the gene therapy is so good for a patient with SMA, unfortunately, if the patient of the SMA or the patient's family of the SMA, they still feel they are very scared about the gene therapy. They think that if the gene therapy will change their gene, that would be not healthy. So the patient, even you have a good drug there, it's not equal to everyone will come to the therapy. I can take for more generic example, COVID-19. I think most of you experienced a lot of COVID-19 in the past 3 years. So someone is still very resistant to the COVID-19 vaccine, right? So even the science tell you, yeah, you can get the vaccine, then you can get rid of the threat of the COVID-19, but some of them still refuse to get the vaccine, right? So that's some environmental social factors. So if you want to your drugs effect, you want to use a new therapy, very helpful for your patient, you must take all of them. Okay, so you cannot only consider the new therapy only. Even you have good therapy, you cannot bring to your people. That is still will not take any effect. We will see in the later example. So life expectancy is changed so much. I mean, back to the maybe thousands years ago, or you back to the Netherlands age, we only, generally speaking, the people can only get the 30 years. But currently, a lot of countries, the average age is more than the 80s, right? More than 80s. And of course, if you are interested, you can check Google. Then you will find the average life expectancy of the US. It's not so good. I mean, the general speaking, the average, I remember the US average is still less than the 80s. Okay, so it's not so good. But I mean, in the recent 20 years, you will see. Do you see that? Okay, from the there's the 600s, right? The 1,600 years, and the current is already the 2020, 2023 right now. So you will find that in the recent 200 years, our life experience, I mean, our life expectancy increased a lot. Okay, so I want all of you here, you think about why. When I have my class in my National Power University, most of the freshmen, okay, I mean the freshmen, some of you probably will become freshmen soon, right? So they will tell you, okay, Dr. Yan, That's easy. It's very direct. That's because of the advancement of the medicine. Of course, because medicine improved a lot, then the people can live longer. Then we will see this is in a recent 200 years, right? But is this that reason? Is this the true reason? We I don't have the time to talk about the medical history. I mean, the medical history, but interesting is that the reason, the true reason to make the people can live longer, medicine is very important. But the environmental, for example, I can tell in the recent 2 years, we developed the better hygiene, right? Your hygiene improved a lot. Our nutrition improved a lot. Okay, so the first antibiotics, I think you know the antibiotics. The antibiotic was created in the World War II. It's around the 1944, 45. But you see the the invention of the antibiotics happen for the human is very important because it can treat a lot of infection. But you will see before the 1944, 45, our life expectancy is already increasing, right? So the medicine can improve, can make people live longer, but not is not the only reasons. Now I want to talk about money. Why? Is money important? Yeah, you should say, of course it's important. There is no money, you cannot do anything. Just like I say, we have talked about if you are poor, right? I mean, the first example from BMJ 1992, they tell you what? For the family who had the better social economic status, we can say directly, if your family, they are rich, then they can live longer. If you are poor, you will live shorter, okay? So if we say so, we can say your axis here would be GDP. So the gross domestic income, okay, that would be the per head per person. So you will see, and the y-axis will be life expectancy. This is not very new paper. It's back to around 20 years ago, but I want to share with you. Do you see the line here, right? Okay. So I think all of you here, you are very smart. Can you tell me what did you see? If your country is richer, do you mean your life expectancy of the country is higher? It seems, yeah, you are right. It seems to look like it's, I mean, this description is right? But you see there's a two zone, right? One zone, we can say this zone, I mean, the first zone from the 40 to the, 40 years old to around 70 years old, it's increased a lot. It means what? I mean, for those country, if your country is richer, then you can get the good expectancy. However, after some point, you will see even your country is rich. For example, you see our country, USA, right? USA is very rich. USA the GDP is high, but you will see our life expectancy in the US is not the top one, right? This is average. So you can see, I always told my students, medical students in Taiwan, say that, okay, so when we talk about US, the US have the most advanced cut-off age new therapy. Is that right? Of course. But this kind of the benefit cannot generally, very averagely with every person in the US. So that's the reason. Even GDP here, US is even higher, but you will see our life dependency in the US is not the best one. This is data is very, very good new. I just here this week I copied from the OECD, Organization of Economic Countries. So you can find us in the website. Okay, you will see that for the US, from the 2018 to the 2021, we around the 80% of the GDP budget we spend in the health, okay, for medical. So if we say the more investment in the health, then you can get the better result. Then the next slide, you should see the life expectancy of the US should be in the right side or in your left side. should be in your right side, right? Because you will see United States spends the most higher money. You see that red point? Okay, you see the second place is Germany, right? I mean, the spend percentage for the US is very higher than the second one, right? The Germany is only you can see it's around maybe, okay, we can say, I mean, 30, even the 30%. But the United States spend 18% of the GDP. Interesting, if you see the next time, you will see, oh, unfortunately, where's the US? Oh, it's less than that, 50%. You will see so many countries. Yeah, you see. Do you remember you will see the life expectancy in the right side is Japan. So Japan is very famous because Japan is one of the most aging society in the world. It's not very surprised because Japan is also the very, I mean, the very, this is the modern country. So, I mean, the Japanese people, they live longer. Everyone think yeah, it's good, right? I mean, it's reasonable. But if you see the United States, then you see who is ahead of the United States. Then you will see, for example, you will see Portugal. You will see Turkey, right? You will see even China, China is very close to even the better than the United States. Then you will see the Greece, right? You will see Costa Rica. Where is Costa Rica? Costa Rica is in the South Africa, and so South America, right? So I mean, you will see it doesn't mean you spend more money. Yeah, generally speaking, we can say if you are rich, you can get better health. But sometimes even you invest most of the money there, you cannot bring all of your health because do you remember previous slide I showed you the factors regarding of health, right? You have you have the medicine, you have the genetic disease. Then, just like I said, the US can use the cut-of-edge therapy to take care of this 40%, but still 60%. Yes, there comes a lot of the different kind of factors. But for example, if you are interested, you can Google the literacy. Okay, you can find how about the literacy in the US. You must be very surprised. The literacy in the US is not so good. Compared to the US, compared to the Taiwan, I can say generally speaking, the literacy rate in the US is poorer, is lower than those in Taiwan. So that's one kind of the factors will affect our life expectancy, will affect our health. Okay, so the next interesting that if you got this kind of concept, I want to share some very, very interesting this kind of concept for you. Everyone here, you are the member of the CANDO, or you are interested about to promote the health of your, I mean, for the patient or for the patient's family, right? So, can you differentiate the two words here? For example, can you tell me what is the equality? What is the equity? Is that the same word? And what is the efficacy and what is the effectiveness? You probably feel a little bit confused, right? So you can okay, you can Google that, and then Google will tell you, or the ChatGPT will tell you a definition of the equality and the equity. Then you see your right side, you see these two figures, right? So if we let us talk about the equality and equity first. So can you use these two photo to try to understand the difference between the equality and the equity? Then interesting, right? So I give you this. I think I forgot why I copied this photo, but I mean this photo, this picture is very interesting. Do you see the equality? If we are saying, in order to make the equality for everyone, so we give the reimbursement for everyone, then everyone can get some money from the government. That would be this kind of the policies always happen in the current society, right? But we also want to pursue the equity because everyone cannot be. I mean, when we cannot choose our parents, right? So everyone, of course, the parents care for us. Then the reason why you can be here, it must be something related from your parents. That's definitely. However, if someone born in a very rich family and someone born in a very poor family, then we are saying the person, the child who was born in a richer family, they can get always the good opportunity, always better than the children in a poor family. Then this society cannot be changed. That will be always like the your left side, right? So how can we make the equity? And even we can just remove all the this kind of obstructions there. That will be we call it liberation. That would be the very ideal situation. But actually, we do not have this kind of the ideal situation. So this kinds of the equality and equity is that for our medicine, for the good drugs, you will see when we talk about drugs, then we talk about the price. The price is very important to the revenue for the pharmaceutical company, right? Because that would be they can earn the money, then they can bring the better drugs for the patient. But in the other side, we will think about the equity. How can we make the people who need the drugs can also get the drugs? That would be also very important. So for if one day we talk about the drug company, you will see in the drug company, the medical doctor or scientist, only one part of them. Because who can really bring the drugs to the patient? Not the scientist. Scientists, you can make the drugs in the lab, right? Medical doctor, you can make the clinical trial to show the efficacy. However, if you want to bring the drugs to the patient, you probably need people working for the commercial. Okay, so this is a teamwork to bring the drugs to the people who really need that. So this is the same. I will not repeat, but basically you can check some Google, some internet, try to figure out what the equality and equity. Okay, so the next one is about. Do you remember? I want to talk about efficacy and effectiveness. When you, I mean, in the previous research, this is very common. For example, this is one kind of the malaria. Malaria is the one kind of the parasite infection. This infection is it's not in US, it's in the African country. So the malaria was transmitted by the mosquito. Okay, that would be easy concept. So recently, the scientists find that they can use a vaccine. It's a bit like a COVID-19. So if we can give the patient, especially the children, because the children, after they got the malaria, they can die easily. So the best way is that we give them a shot, we give them vaccine, then prevent the infection of the malaria. Okay, so for all the things you will hear about is that they will do the clinical trial here. So that will be, we will see there are two groups. One is a control group, the other experimental group. Okay, so for the control group is the group they do not receive the vaccine, and the experiment group is the group they receive the vaccination. So the easy way is that 7 years later, then you will see the paper you do the report the efficacy, and the efficacy is very straightforward. So the numbers of infected malaria, right? So I mean the patient number. So if I'm saying the malaria vaccine can effectively to prevent the malaria infection, what do you expect? You should see the patient number of the malaria infection is lower in the experimental group, right? It's very easy, right? So okay, so that's true. I mean, after this study, the malaria vaccine implementation already approved by the WHO. It means WHO say the malaria vaccine can help the children in Africa. So it is very important to bring the malaria vaccine to the Africa children. So this is, I think you're probably very familiar with the COVID-19 vaccine. So if you thought about it around 3 years ago, when the US, United States have the UK have the first COVID-19 vaccine. Then after that, the US also have the Moderna and the Pfizer, right? So when we talk about the COVID-19 vaccine, I think back then, there were a lot of the topics talking about the equity. How can we distribute the vaccine to the different kind of the world? I mean, over the world, we cannot make only the rich companies. Sorry, we cannot make the rich countries available to get the vaccine only. We should distribute them over the world, right? So if this is the drugs, it's good. I mean, it's good. It means the efficacy is good. Then that would be from clinical trial, from the science, right? The scientists, the medical doctor tell you, okay, this is a good drug. If you can get this good drug, then you can avoid the malaria infection. I want to tell you the very important here, you have to differentiate about efficacy and effectiveness. Okay, so for you, for all of you here, when we talk about awareness of the neurological disease, are you talking about efficacy? Do you care about efficacy more, or do you care about effectiveness? Effectiveness is happening. I can say the effectiveness is the efficacy in the real world. Okay, like I take it for example, the drug is awesome. The drug is good. The COVID-19 vaccine is so good, but some people still do not want to take the vaccine. So efficacy is good. It's proved from the scientific evidence. However, for those people, they do not want to take the vaccination of COVID-19. There is no any effectiveness for them, right? Because they do not have the vaccine. How do you expect they get the effectiveness? I mean, how do you expect them to have the protection from the COVID-19 vaccine? Okay, so this is the difference from the efficacy and the effectiveness. So when we talk about the effectiveness, is that if you want to make some good drugs, you want to improve the population's health. You have the knowledge of the efficacy, but you also have the knowledge how to make effectiveness happen. Okay, so I want to tell you one example here is that the smallpox. Do you know smallpox? I mean, this is when we talk this word eradication. So what is eradication? We want to remove. I mean, for the human, the ideal situation is that okay, there is no disease in the world, right? Can we do that? Of course, we are not. Otherwise, why we still have the medical doctor, right? So no, a lot of disease is there, but we want to remove. I mean, at the end of the day, if we can remove some infection disease, that would be awesome. COVID-19 can be removed? Probably not. I mean, COVID-19 is still in our world, right? So only one disease right now is true was removed. It is smallpox. So everyone, you have to Google. You can find out where is smallpox. Smallpox basically would already disappear in the world. It only exists in the US CDC lab. Okay, it is become. I mean, it's all I remember. If I'm correct, I'm not sure, but I remember the smallpox, the virus only currently exists in the United States CDC lab and in Russia. Only the two labs in the world have the smallpox virus. Okay, so for people we want to remove this kind of the disease. So what would be the next? The first one in the human history would be the smallpox. The next one will be polio. I think all of you here, you definitely received the polio vaccination. Okay, so in the United States here right now, probably you get the vaccination that will be from the intramuscular injection. So in the polio, for the WHO, okay, you see a lot of here, right? So you probably know the WHO, you probably know the CDC. Yeah, this is very highly related to the United States. We want to eradicate the polio. It's easy. Of course, it is not easy. You will see this. I give this for this shot, snapshot from a few days ago, from June 13. Okay, so you still see a different color there, right? Some countries they still have some outbreak of the polio. I want to make you see the in the map in the yellow part. Do you see what the yellow part here? Do you know what's country? It is also related to the United States. I mean, when Biden, yeah, the President Biden, he withdraw the military from where? Afghanistan, right? So one of these countries is Afghanistan and Pakistan. Okay, so I want to tell you this, for example, is that I'm not sure because I want to hear is that sorry, this is a Chinese because this is previous my class. So I hope that some of you can read this one. So this is a few years ago when they want to eradicate the polio, they need a lot of money. Here they tell you that there's so many money to eradicate the polio. The reason is that do you see in this photo? You probably do not remember how do you get the vaccination, right? Because but you probably know. Okay, you can imagine in the United States, when you want to get some vaccination, you went to there, you go to there. First, you go to CVS, right? You go to the physician's office, and the MP, the pediatrician, or the physician assistant can give you the shot. Okay, so that's what happened in the here. But for Pakistan, for Afghanistan, how do you get the vaccination? Because uh, the vaccine, the drugs, probably need some refrigerator, right? But are you sure everywhere can you get a refrigerator? If not, you need this kind of ice box to put some ice there to keep the vaccine cool down. So yeah, so you can imagine when you want to distribute the vaccine to some remote area, you will definitely have encounter some challenge. You will encounter some barriers because even you have a good drugs, but how do you deliver your drugs to your remote village? Then how do you keep your vaccine safely there? Okay, so based on this knowledge, I can just give very quickly. This kind of the environment here is that how do you polio can, I mean, transmitted to people, because polio, the virus they are generate, there will be in some very ungood, I mean, non-hygienic environment. So you will imagine, even you have the vaccine, you can kill the virus. But if your environment did not improve at the same time, sometimes it is really, really very hard to eradicate some virus. Okay, so it's back 2013. One day when I read the Time magazine, okay, I am very shocked because at that time I cannot understand what this topic talking about because they are talking about the killing polio. Okay, so I can understand the all over the world want to kill the polio because we want to eradicate. So I know this context. However, what the polio and the politics, these two words can put together. Actually, because polio is some kind of disease, right? So when we talk about this virus disease, you can talk about the you can talk about the medical resources, you can talk about the vaccination. That would make sense, but I cannot understand why the polio and the politics they can put in in the same page. Then I also see a very interesting word. Do you see the Osama bin Laden? Okay, so you read this topic, right? The polio and the politics. A great the scourge might soon be gone, but the war, mistrust, and even the death of Osama bin Laden could get in the way. Okay, the story is that, do you see that in the map I show you? In the 2000, I mean, in the current time, 2023, June 13, the polio still exists in Afghanistan. But back to the 2013 at then, the real situation at that time, the polio was almost eradicated in Afghanistan. Unfortunately, I cannot say unfortunately. I mean, when Osama bin Laden was killed by the CIA, by the US, many people was very happy. But unfortunately, these things make change, made the polio unable to be eradicated there. Okay, so interesting. If you want to see some movie, you can check some movie. Okay, there's a movie they talk about here. So this is around 10 years ago already. But I mean, this is some this is not a documentary. Okay, this is really like the movie. Okay, so it's a very easy one. You can watch it. And then they just tell you how U.S. government, how Obama, how CIA they killed the Osama bin Laden. Okay, unfortunately, is that this is the some stories that because in this movie you will see the CIA. Okay, I mean that's the real thing, not the movie. Okay, I mean in the movie they show you how they get the information, how they locate the locate the Osama bin Laden in the some building. It's because there are some rumors. They say, okay, CIA they will fake the vaccination healthy care worker because whether this is real or not, I mean real or not, I am not mean to CIA did these things or not. I'm not sure, but a lot of the rumors there they told the local people because do you know when they want to get the vaccination, they send the health worker door to door, okay, to knock the door, to ask the parents or the mom bring the baby out, then give them the vaccination. So they almost kill, they almost eradicated the polio at that time. But the rumor after these things, the local people say that okay, the United States they will send the CIA to fake the healthcare provider. At the end of the day, the local people did not believe any healthcare worker anymore because they feel like maybe some of them they are CIA. Okay, so this news probably fake. Unfortunately, this make the untrusty between the local people and the healthcare worker, right? So the local people started to refuse get vaccination anymore. Okay, and some people also say that they give some rumor. Okay, if you get the vaccination from the US, from the WHO, the vaccination there, the vaccine they also contain some other virus. It's not good for your kids. So due to this kind of untrust environment, most of the people, most of the mom, a lot of family refuse to get the vaccination for the polio. So at the end of the 2019 and early 2014, the infection of the polio increased and the research again. Okay, so this is some case is tell you. I mean, the story here is not tell you what the U.S. government did. No, the story is tell you sometimes you want to make you. We already have the drugs, right? We have the good vaccination. The vaccination have a good efficacy to prevent the infection of the polio, but something happened, and something happened is totally irrelevant from the medicine. It's some political event, but at the end of the day, they affect our efficacy. Effectiveness. Okay, so this is what you have to know is that encourage you is that sometimes some students told me, okay, when I do the promote the awareness for some disease, it's boring. I mean, I want to be a scientist. I should be some guy, the medical doctor to treat the patients. Yeah, that's awesome. That's good. But if you want to make people healthy, I think that's not the only thing. The other people, if you can figure out how to, for example, if you can make some project to send the vaccines to the remote areas, and if you can make a good, friendly environment to make every family, every mom, every parents want to bring their children to get the vaccination, then you are awesome. You are cool because you make something happen. Okay, this kind of effort would be equal to the invention of new drugs in the lab. Okay, so this is what you should learn from today. Okay, so due to this kind of the mindset, this is my mindset because I'm a medical doctor back in the Taiwan. So of course I treat my patient. I involved my patient's life day by day around 15 years. So I really appreciate be part of my patient's life. But based on this kind of things, what I share with you, I also love to change something from the macro level. You remember, as a physician, you are doing the micro level. That's good because I said, it's very lucky for me to be a physician, to be part of my patient life. But if you can do something from the macro level to change a population, change a group of life, that would be also good. So um, back to just I should tell you from the 2012 to the 2019, I did my project in the Ladakh area. So you will see the Ladakh area there would be around China, the Tibet, right? So around the North India area, and that part will be Pakistan. So I brought my students from the National Taiwan University. And not only my program, on 60% they are the medical school students, but my team still have a lot of the students that come from different background. Maybe some of them come from engineering. Okay, some of them they come from even they talk about foreign language. So we have different kind of the students, not only medical students. So we work together. So we make every summer we will make there. So the Ladakh is in the Himalaya mountain areas. Is over the 10,000 feet there. Okay, so during I do not have time to share this program, but there's some video here is my students they make this video, so you can use your QR code. I can share with you this slide later, no problem. So often you can see that this is some video that make that okay. We speak in Chinese, but we have the English script. So for those you cannot understand the Mandarin, that's okay. You can still see what my students, what my team, what our team did from the 2012 to 2018. Then 2019 is my last year because that will be before COVID. And after COVID, the project stopped and I came to the US. So we did not conduct this project right now, but at least from 2012 to 2018, we work with the local health worker. Then I also work with the teachers from the Taiwan. So we also have some education program there. Then you will see this photo here is some of the high school students. Yeah, they are also the around from the ninth grader to the 12th grader. Yeah, so we work with them, have some work with the local teachers, also work with the local health worker. So we do have some dental service. We also have the time to do the health examination. So the health examination. That's sometimes if you want to do some good program. Like I said, you want to um, make some people, some population, make group of people healthier, right? So we do this by science. Okay, we do not do by this by our kind only. Compassionate is very important. Okay, however, your profession, your skill set is also important. Okay, because when you want to, well, I always told my students, if we were not there, all the kids there, all the community, they still have their life. We only go there only in the summer, and among the 1 year, 365 days, not their life, right? So eventually, the most important thing is that when we are not there, what they can do. Okay, so that would be the very, very important things for your ed project. I mean, your ed project is nothing to do, not only to do with what you have done. The most important is that if you are not there, how can they do? That would be important for all the international or the global ed project. That would be something there. So when we have this kind of the different kind of schools, local schools, or the local community, we definitely do by the step by step on the scientific step. So we collect the data, we analyze data, and we show the data what kind of things we have done there and what kind of the health status they improve instead of telling a story only. I mean, a story that someone come back from Africa, come from some country, and then they'll tell you, okay, I want to share you one touch story. That's fine, that's good. But the most important is what of things, what kind of result I have done here. That would be I want to share with you. So that's the reason I pursue my epidemiology, because epidemiology with one kind of a science can show you what we have done for this population and how their health status improved. So I think it's also almost done here. I want to share with you with that. Okay, so I think all of you probably after your graduation or after you go into a college, you will choose a different kind of the field, right? Some of you become the scientist, some of you become the medical doctor, some of you maybe become some project manager. That's fine, because I think if you want to improve some population or some groups' health, we need a different kind of the skill set. Okay, so while here is okay, you have to have an open-minded. Then you have the skill set to problem saving. You have to adaptability, right? Because while you want to do something good, I mean, when I say good, it's based on their culture, it's based on their local needs. It's not your need. You have to remember that. You're doing the things for the local people. You are not doing things for yourself. I always tell my students, if you want to do something, you want to go to Ladakh area, you want to go to Africa to do some good. But if you do not have the good concept, I would rather you to be some traveler. I mean, you can do a tourist, because if you are a tourist, at least you will pay the money for the local people. You have the local economics. If you feel that, oh, I'm come here to have something, to help you, then you ask everything is free. No, there is no volunteers free. So you will see this project in those 8 years, everyone, included all the employee. I mean, and the members is not adult. Even for students, if you want to come, you have to pay. Okay, there is no free. I mean, there's no free. If you are doing the volunteer service, what's a volunteer? You cannot do the volunteer. Then you go there, you go to Himalaya, then say, oh, I'm a volunteer. So can you give me the free accommodation? Can you give free meal? No, you can. You have to afford your meals. You can afford your accommodations. So some students come to me, Dr. Yan, I do not have a budget right now. I said, that's good. It's okay. You can come next year. If you cannot budget, why are you hurry to come with us this year? I will be here always waiting for you. So no problem. You can come next year. But I mean, if you cannot afford yourself, you can wait until your preparation is good. So I think the final one is just to want to encourage everyone here. Sometimes when we talk about if you are one member of CANDO, I think whatever you want to pursue in the future, not only a science, okay? I just want to remember, just remind everyone, emphasize again, when we want to promote health, okay, not only the science, and we need some non-science work, especially you are good program project manager. Project manager is so important. If there is no project manager, how do you coordinate the different kind of the professionals, right? For the medical doctors, they only know they are the profession to treat the disease, but they are not the professional to be a good negotiation, right? Okay, so I think this is almost the last one. Then I always say everyone comes a different kind of things. So when you do the things, you can think globally. Okay, so I mean, you can learn a lot from the internet. You can learn a different kind of the story from different people. But action is very important. But action, you have the action locally. When I mention about locally here, it means you have the action locally based on the local culture, not the language. Okay, language is the most not a very important things, I think, but you have to know how to respect the local people, how to adjust your program based on their culture and their current situation. You are doing something to adjust your program, try to provide some benefit for them, not for yourself. Okay, so I hope this is not a very long speech and probably not a very scientific one, but I hope this kind of sharing would be helpful for your young guys here. Yeah. Okay, that's all.
Okay, thank you, Dr. Yan. Like, I think like what you like talked about today, it's really closely related to what Tsuji, such as like their medical outreach, and then also like yeah, medical outreach specifically, like what they're trying to like achieve, and then what they're what are they trying to achieve. And I think it's a good like reflection for like everyone to like think about when you every time you go to the medical outreach, like why are you going to be there, and then like like your action will actually make an impact. Like even though if you're not interested in medicine, like just being there and then helping out the people in medical outreach, it's a really good way to help the community. And
Yeah.
yeah, and then I think if anyone have any questions right now, and then we can have like a brief Q&A session. Oh, if no one wants to ask a question, can I have a first question?
Yeah, sure.
Yeah, so yeah, Dr. Yen, you talked about like your project in like Letica. Like, what are some more like details of like what you guys did? Like, what kind of like maybe like institution, like what kind of like what's the process like getting, for example, like establishing some like maybe health institution in the local area, and then having them continue on having like healthcare in the area. Like, what's the
Yeah.
process?
Okay, so basically this project is from the the National Taiwan University College of Medicine. Okay,
Mhm.
so this is important resources part. Resources means money. Okay, it is from the budget. This is the first one. And the second one, what we did there is not that we did not do any free clinic there. Okay, we have some clinical service, but when we go into some new places, I do not like to start the free clinic at first. The reason, the very big reason is that we are the we are not real people. Okay, so the first one is that are you sure the Chinese doctor can prescribe the drugs there? Okay, I think in the United States, even for Taiwan, no, if you are the foreigner doctors, are you sure can you give the drugs for the local people? Is that this is very basic knowledge, very high level, right? Is that the role allow you to do that? Okay, this is the first one. And the second one, where does your drugs come from? You bring the drugs from US or you bring drugs from Taiwan to there. So why do you not use the local drugs? Why do you use your drugs? Because the local healthcare worker, physicians, nurse, they do not understand your drugs. Your drugs are foreigners. Then you come to the 2 weeks or 3 weeks, then you will go. You leave a lot of the drugs there. Are you sure that's safe? Is that safe? If something happens, some adverse effect after taking the drugs, who can take care of the patient? that would be not you, right? That would be a local people. So I do not like to do the free clinical there. So what I did for this project, I always from the like I said, I do the health examination first because I want to understand what kind of health problem there. That would be the first step. The second step is that I will show the result to the local people, to my local partner, and I say, okay, this is what I from my results. Then what's your comment, right? Is that the real situation you have in your community? Okay, if so, if we have the 5 questions, 5 problems, 5 diseases we want to taking care of, so what would be your priority? So this is what kind of communication. And this kind of communication is not based on my imagination. It's based on my work, right? Health examination, epidemiology study. So I think that's what I have to do this. And when I do this, of course, I take some example for this is the healthcare and the public health, right? But the next step is like you said, because, for example, I want to promote some awareness for some chronic disease. For example, I want to promote the awareness for diabetes. Then I will ask my students to have some awareness program. But when I did that, I will not do myself. I will ask my nurse, ask my teachers, because when I talk to my young guys, young freshmen, or they are sophomore, they always tell me that yeah, we did have a good class. Then I say, what do you mean the good class? Because when we had a class, every child there, every the local residents, they are like our program so much. Then I say, also, when I have a class in the university, I just feel only the 50% patient and the 50% students are hearing my class. Then you say you are preparing some class, then everyone is hearing you. That's impossible, right? So these kind of things we need a team. The team who can teach the class, who can design the class. So I'm the medical doctor. This is not my specialty. So I always like with a different team. That's what I have did in this LADAC program. Yeah.
Okay, thank you. And if anyone has any questions, you can just unmute or you can type in the chat.
Hi, Dr. Yang. In your presentation, you talked about efficacy, equality, effectiveness, and
Yeah.
equity. I was wondering, can you give us an example of the problems you have to weigh with efficacy and effectiveness in your work?
Oh, okay. So I take the vaccination because vaccination is relatively more easier to understand. So I just give I take the COVID-19 a little bit. Okay. So when you think about what happened in the past 3 years, right? So when we talk efficacy, is that the COVID-19 vaccine has good efficacy. So what do you mean good efficacy? Because in the clinical trial, in the evidence, they tell you for the patient who took the COVID-19 vaccine, only a few people can get the COVID-19 infection. And most of them, I should say the vaccination can prevent the severe disease, especially they can prevent the death due to the COVID-19. Okay, so the efficacy. So next problem is that the effectiveness is not so good as the efficacy because in the clinical trial, everyone was controlled, was monitored. For example, you came to for example, if Pfizer, we need a 2 shot, right? So we will show, and these 2 shots, the interval between the first shot and second shot, for example, the 4 weeks, 1 month, if so. So if in the clinical trial, really happens that you get the first shot, then someone will call you, okay, Kevin, it's 4 weeks. Please come to the next week because next week you will get the second shot. So I will make sure in the clinical trial, in the program, I will make sure everyone gets the 2 shots of the vaccination, right? However, in the real world, is that some people came to the first and forgot the second. And why they forgot the second? Because, for example, I'm too busy. I have to care my children. And for example, my working hours, I'm poor, so I have to do 3 jobs. I don't have the time to get my second job. If I tell my boss, for example, I'm an immigrant and I do something in the restaurant, this is not a permanent job. So if I tell my boss, I have to get my vaccination and I cannot come to the restaurant today, then my boss will tell you, oh, if you cannot come, you do not come in the forever. So I will lose my job. So in order to keep my job, I have to go to work. So I just postpone my vaccination. So this is what happened, the effectiveness. So in this situation, if you want to get your efficacy 100% transfer to the effectiveness, not only give the good vaccination, you have to make sure everyone can get the vaccination as the same in the clinical trial. So sometimes we will tell you, for example, we will try to provide some reimbursement, right? We will tell you, first of all, we will give some company, so okay, please, the government want to promote the vaccination. So if your employee can go to the vaccination, then you show me some evidence, then I can reimburse you. So I mean, there's some company and some different kind of small companies, they can encourage you. They can give some vaccine, some not vacation, some free time or the sick time for the patient and for their employee to get a vaccination. So this is something come the efficacy and the effectiveness. So for the efficacy, that 100% very scientific things. But for effectiveness, that would be very complicated. So that's the reason I just show you, whatever you did, you still can promote your professional into the health promotion, or to this kind of improve some population's health.
Thank you.
What if someone's allergic to the COVID vaccine?
You mean something allergic, right?
I asked if, like, what if someone is allergic to the COVID vaccine? Then
yeah. So that's good question. So I think for those patients who get allergy for the COVID-19 vaccine, that would be some unlucky case. So for them, they cannot get the further vaccination. So as in this situation, we need the most people get the vaccination because we want to use the group to protect this kind of patient, right? So sometimes we just I say, the health sometimes not only involve the individual, we need a macro because some of them they cannot. For example, take this for example, if you or someone your family they are allergic to the COVID-19 vaccine, then they cannot get vaccinated. So it's better way that all the people around this patient should get a vaccine. Then you can protect this kind of special people who cannot get the vaccination due to the allergy.
All right, thank you.
Yang, I learned about the differences between efficacy and effectiveness and equality and equity. And I think his examples, images really allowed me to understand these words, like in terms of like the medical world and how much of a difference it really makes. And also learned that stuff like money and like more like land and stuff does not always guarantee like high life expectancies. Like for example, the US, like even though like we're like one of the richest countries, our life expectancy is like not as high like as compared to other countries like Costa Rica. What makes today's topic important? Well, I think today's topic is important because it really brings up the issues around these diseases and like the vaccines and how like we're meant to treat these diseases. And my takeaway from today's event is the 4 E's: efficacy, effectiveness, equality, and equity, and how they're important parts of the medical world, and they should be used so everyone receives like fair and equal medical treatment. And how can I be a part of this cause? I think I can be a part of this cause by spreading these ideas and awareness to other people and ensure that there are more awareness of these issues challenging our people. And thank you.
Okay, thank you, Darren. So if anyone from group 2 can share their reflection.
Yeah, I think all of us are gonna answer each question. Is that okay?
Oh yeah, of course.
So Dr. Yang presented a wide range of difficulties found in medicine, especially pertaining to vaccines. His comments about the importance of equity gave me a better insight as to how essential it is that we acknowledge different situations patients are in, including terrain, technology, and culture. And I also learned about smallpox, which became the first eradicated disease in human history.
Okay, so we can learn more about how every part of human life and the medical advancements we made as a whole, as well as learn about different crisis situations and learn about why they did or did not work, and learning history so history doesn't repeat itself.
And for what is your takeaway from today's event, we said, I think it's important to know the different effects of vaccines and what they have to do with society. Educating others and its importance can lead to a more healthy society with a longer life.
And to be a part of this cause, we can take advantage of all the experiences that Tzu Chi can offer, like medical outreaches and participating in extracurricular and outside activities. And these experiences would allow just anyone to step out of their comfort zone and learn more about like the health and medicine field. Yeah.
Okay, thank you, Group 2. So if anyone from Group 3 can share about your reflection.
Okay, so a general gist of what we learned today was about like the importance of vaccines and how being wealthy doesn't exactly equate to a higher life expectancy. In fact, the amount of education you have can actually affect your lifespan. And then today's topic was really important because it helps raise awareness about the importance and the impacts of medical advancement, as well as the different diseases that vaccinating has helped reduce the severity of. And it's important to make sure that people are educated about just how important these services are in order to keep everyone, not just yourself, healthy. Some takeaways from this event were that distributing vaccines to remote areas of the world is very important. And if you want to help remote areas, one of the first things you have to do is to help them with healthcare. And you can help be part of the cause by encouraging others to vaccinate, raising awareness about the importance of, again, healthcare and being vaccinated.
Okay, thank you, Allison. And if anyone from Group 4 can share their reflection.
Okay, so as a group, we learned about how there are many facets that are vital to the mission of spreading medicine. And in today's illuminating presentation, Dr. Yang demonstrated just how essential some of these facets are, from understanding the different ever-changing socio-political and economic barriers that one must maneuver in delivering medication. For example, how Dr. Yang talked about in Afghanistan, the murdering of a perhaps popular political leader helped decrease the efficacy of vaccinations, to how despite being a pretty wealthy country, America still has one of the lower life expectancies. And not only that, we also learned about the importance of interpersonal skills, being able to mediate and being able to talk to other people. All of those helped us as CANDO members be more knowledgeable on this field. And in his closing, Dr. Yang shared some insightful words that I think we can apply to our work, which are think globally and act locally. As we strive to widen the scope of communities that we can aid, we must be open-minded to the turbulent circumstances that might influence our work. Be compassionate of the people that we wish to assist, and apply that knowledge to our actions. Only then can we maximize our potential in helping people.
Okay, thank you, Kelvin. And if anyone from Group 5 can share a reflection.
Okay, so each of our members are going to talk. They have their own reflection. For me, something I learned from today's presentation was the difference between equality and equity, and how Dr. Yang described each word with his own examples. And I also thought the data that Dr. Yang showed us was really interesting. And as we compared ourselves with the rest of the world with medicine, I thought today's presentation was also really interesting and inspiring, how Dr. Yang was really good at sharing things and the projects that he's been involved in. He was also an excellent inspiring people to get more people involved in the medical field. and discussing how to make the community a better place, even with medicine or vaccines. I think I can be a part of this cause by participating in more medical outreaches in the future. And now, whenever I'm participating in a medical outreach, I know that I will be helping and supporting many people.
From today's presentation, I learned that money and health have always been connected, such as a better social status leading to more access to healthcare. And I think today's presentation was to make a more global impact with medicine very well. My takeaway from today's event is that it is very important to start locally when aiming for better health worldwide. So I can be a part of this cause by attending medical outreaches to support a better environment.
So my reflection is I learned that the life expectancy of people back then was less than 60 years old, which really showed how much we have improved in the medical field overall. I think today's presentation was very informative and helpful. I learned a lot about statistics on different medical issues such as polio, COVID-19, and life expectancy. The speaker seemed very passionate about his work and was very open to share his experiences with us. Although I'm not as interested in the medical field, I still felt that I learned a great deal from this presentation. My main takeaway from today's event is to always appreciate what we have today, and that any help we can provide will make all the difference. I believe I can contribute to this cause by joining more CANDO events to learn about other medical problems.
Something I learned from today's presentation was how different values can lead to different impacts, like efficacy versus effectiveness. I think today's presentation was educational and instructive. The infographics and images Dr. Yang provided allowed me to understand specific concepts related to health. And by intertwining his past experience with current events, Dr. Yang's message was really clear and meaningful. My takeaway from today's event is how values play a crucial role in shaping human behavior and decision-making processes, such as how the values of equity and equality can lead to completely different impacts based on individuals or societies. I think I can be part of this cause by participating in medical outreaches and supporting more CANDO events in the future.